Hello, everyone, and welcome. So, why choosing EMDR for your practice? If you have found yourself lately stuck in your work, or perhaps even in your personal life, we are all human beings before being healers. But especially in your work, if you found yourself with some of your clients at least, reaching that point where there seems to be a big elephant in the room, and both you and your client are trying everything in your power to go around this elephant, not knowing how to approach it, and working so hard to the point of exhaustion or frustration, or even losing hope that real change is possible, that you can both get unstuck and regain that flow in your work. So if that applies to you, EMDR has definitely many answers, and it certainly helps in many ways. I am very passionate about EMDR, and I will try to state some of the reasons. I cannot go over all of them because there are many, but some of the reasons why I truly believe in EMDR. I have been using EMDR for almost 20 years, and I keep being amazed and humbled at how wonderfully sometimes it really feels magical. It feels miraculous of how is it working. And for this reason, because it seems that sometimes it's EMDR, it works a bit, and it is a bit too good to be true. So for this reason, it's been one of the most researched therapies for, especially for trauma treatment. And with so many researches over the years, especially with the help of the neurosciences, there have been quite a few theories trying to explain how EMDR is working. It hasn't been a consensus yet in this regard, but the consensus is again and again and again that EMDR works. And I can definitely testify this from my own practice. I came across EMDR almost 20 years ago. I was already a seasoned therapist at that time, but I was working with a tragic situation with a family that lost their son, their young son, in an accident, a gang shooting. I really tried my very best and used everything that I learned. And I've been trained in many therapeutic approaches before, with extensive training. But everything that I tried, of course, in these circumstances, nothing really seemed to work, except perhaps my presence as a human being, coming from a place of true compassion and love for them. But in terms of my skills and my professional competency, I felt completely helpless. And at the same time, I would have something magic that would just take their pain away. So I didn't give up on hope, and I started searching everywhere. And it so happened that I came across this book, The Induced After Death Communication, by Alan Botkin. I still have it here with me. I started reading it because, of course, the parents wanted to reconnect with their lost son, to find a way. I didn't know any way at that time. So I started reading this book and wanting to apply it. And soon enough, I found out that actually this approach was actually an extension of the EMDR approach. So this is how I learned for the first time about EMDR. I have always been a strong believer in self-learning, self-development, self-healing. So I tried to learn EMDR on my own first, reading everything that I came across related to EMDR. and it didn't work. Trying to learn EMDR on your own, it's like being a physician and trying to learn how to do neurosurgery on your own. It does require intense, solid training. So I went and got trained. And the more I used EMDR, the more I kept being amazed by it. And at the same time, I truly believed in it. So then I continued. I became a certified EMDR therapist, then an EMDR consultant, being able to support other therapists in their learning process. And finally, I went all the way to become an accredited EMDR trainer. So now I can give forward from everything that I've learned, teaching other professionals of how they can integrate this very powerful therapy in their practice and use it to help their clients and to help themselves as well. So why I'm so such a strong believer in EMDR? First of all, it's a very solid therapy. It's an integrative therapy. So while other therapeutic modalities, and I've been personally trained extensively in multiple therapeutic modalities in CBT and solution-focused therapy, narrative therapy, expressive arts therapy, existential therapy, hypnosis, NLP, Jungian therapy. I had everything that I came across. I always wanted to learn everything I could to be as helpful as I can to the people that I have been working with. But since I discovered EMDR, I became a very strong believer at it. So while other therapies approach whether the cognitions, the mind, or the emotions, or the somatic aspects, EMDR has this comprehensive protocol that integrates all aspects of our being, seeing them as a whole. So it integrates the mind with the negative cognitions or thoughts, the emotions, the feelings, the body, the somatic part. And I also integrate the spiritual aspects of ourselves, the soul aspects into this comprehensive approach. So also EMDR is a very efficient therapy. If you are trained in different modalities, and sometimes clients come and ask straight from the bat, how long it's going to take until I will get better. So with EMDR, you can actually give them a clear answer from the beginning. Researchers show that EMDR can see significant results even after one 90 minutes processing session. This doesn't mean, of course, that you can resolve complex situation in one session. But if it's a simple phobia or a recent traumatic event, that is possible. At the same time, most of the time, it does require more sessions, but not as many as definitely requires with regular talk therapy. So what you might be able to accomplish perhaps in a few years with regular talk therapy, with EMDR, you can see results in a few months. I generally personally have this framework of 12 sessions as a starting point. And within this framework, in my experience, I noticed that you can see significant deep results. EMDR is not a symptom management approach, so it doesn't just work with changing your thoughts or changing the behavior, but it goes to the core point of the current problem. So it sees most of the time the current problems just as a symptom, as a mirror of what is it that is feeding these problems. And what is it? It's at least 80% of the cases. It's that big elephant in the room. It's trauma. in my personal and professional experience, I've never met a person yet that hasn't experienced some sort of trauma in their life. We might believe sometimes that I didn't have any traumas, everything was good, but trauma is not defined by the event, by what happened to us. It's defined by the impact that a certain experience had on us. So in EMDR, there is the big capital T trauma and small t trauma. So the impact is what counts. And that varies from person to person, and especially when we are younger, we are also more vulnerable. And I guess at that time, it's easier for different negative experiences to have a stronger impact on us. So if these experiences are left unprocessed, unmetabolized, then they get stuck. They get stuck in our memory. They get frozen in our memory network. And although life keeps going and move on, and sometimes even forget about what happened, there are certain leftover patterns that we carry within ourselves, and they tend to shape our life, our choices, our feelings, our behaviors. So they kind of shape our destiny if they are left unprocessed. And this is what EMDR does. It goes back to these focal points of unhealed past negative experiences, and it helps them be healed. I call EMDR emotional surgery. So it goes and truly opens those wounds and helps them be properly cleared out and properly closed in a healing place, rather than from a wounded place that keeps hurting sometimes for the rest of our life. And what EMDR does quite amazingly, and this is where I feel truly humbled as a therapist in using EMDR, because it reminded me as a therapist and as a human being that I'm not the one doing the healing. I'm not the healer per se, but there is this self-healing system in each of us. Just like we have all the other systems, we have the circulatory system, the respiratory system, the nervous system. There is this self-healing system in each of us. In EMDR terms, it's called the adaptive information processing system. And this is what does the healing work, the magical work. And just like when we have a wound, a physical wound, and we go to the doctor, it's not the doctor per se healing the wound, but it's our own system. The doctor just facilitates the process. The same as therapists, especially in using EMDR, we are reminded that it's not us doing the healing. Our role as therapists is primarily to hold the space, this gentle, safe, I see it as a sacred space that we are holding for the clients, for them to go through their own healing process. And we facilitate the process. We kind of have the map and the tools, but most of the time we need to be careful primarily to step out of the way, not to interfere, not to overdo it. So this is where the humbling position as therapist comes in, because it reminds us that we have to come into the right position and not take that over responsibility that sometimes we tend to take as healers, to trying to fix, to heal, to repair, to help. But it's an over responsibility that comes with a big price as well. It comes with overwhelm on our part. It comes with feeling burdened by our clients' problems, and taking those heavy burdens on ourselves. And then if we don't know how to release them, how to free ourselves, it's detrimental. It's detrimental for our health. We reach burnout, we reach overwhelm, we might even feel like giving up on this healing path because we feel that it's too much on us. So EMDR puts things in perspective and takes that burden away from us as therapists. It places us in the right position, which is a very significant position. Again, the position of a surgeon is very significant, and at the same time, healing happens from the inside. So EMDR, it's a very efficient therapy. You can see results and you can give that trust. First of all, we regain our trust in our abilities, in our capacity to help change happen. And then it gives tremendous hope with factual basis to our clients, seeing results session after session. I like to see that, and I actually use measurements in my work. I use the outcome rating scale every session, and then clients can literally see the numbers changing, and it's a wonderful motivator. It's a wonderful motivator for us as therapists, knowing that whatever we do, it's actually working, and it's a wonderful motivator for our clients, seeing that change is truly possible, and they can heal, they can unblock the ways to come to their full selves, their real selves, and to come into aliveness, to live the life that they truly hope for and they fully deserve. And there are many, many reasons, but ultimately, I also love EMDR because it's been a very, very powerful tool for me in my personal healing and personal growth process. I'm a strong believer that the number one person that we need to help, we need to heal, is ourselves. This is the starting point, and that's the greatest responsibility that we have. And when we are not healed, just as we can see it with our clients, we are not the best that we can be. We are not the best parents. We are not the best partners or friends, and we are not the best therapists. So I'm a strong believer in that, and I do offer programs called the Unhealed Healer programs to help the healers, to help with our own healing. And EMDR, once I learned how to use it on others, and I got help myself. Again, even a surgeon needs to go to another surgeon when it needs help. But at the same time, at least partially, EMDR can be a very powerful self-healing tool. And once you learn how to use it, it's amazing to have it in our toolbox for ourselves. So these are some of the reasons why you might want to consider choosing EMDR, learning it, and integrate it in your professional and personal development. I offer different programs, both for healing, EMDR, again, especially for professionals, but also trainings in EMDR. So stay tuned for the upcoming programs, and for any questions, any curiosities, please feel free to reach out, and I will always be very, very happy to be of help, to answer your questions and whatever might be needed. So hope to see you soon.